Mr. Lewis, sir.
Question 6, sir.
Mr. Speaker, in the last 5 years, the Labour Court and Employment Claims Tribunal issued an average of 130... Oh, sorry.
Question 6.
I thought the honourable member is going to reply to my question.
But there was a new, just shifted a new ministry.
The success rates of assisted reproduction, or AR procedures, decrease, and the likelihood of medical complications and adverse pregnancy outcome increases with maternal age. It is therefore important that patients are well informed of the risks and outcomes of such procedures. To protect patients' interests, the current age limit for AR procedures, including in vitro fertilization or IVF, is set at age 45. However, MOH considers appeals on a case-by-case basis. In addition, the current IVF limit is set at 10 fresh cycles for women aged 40 and below, and 5 fresh cycles for women above 40. This is because there are increased clinical risks with multiple cycles of ovarian stimulation and oocyte retrieval. These risks include ovarian hyperstimulation syndrome, or OHSS, bleeding and infection. We recognize that recent advancements in AR technology have improved safety of AR procedures in general. The government reviews these limits regularly and will take into account such technological advancements and other medical and social considerations, including the risk of chronic diseases, pregnancy or delivery complications, and continued low success rates of pregnancy and live births for women of higher maternal age.
Mr. Lewis, sir.
Thank you, Mr. Speaker. I thank SMS for the reply. I understand the concerns and risks that she mentioned, but I think these are concerns and risks that parents should consider and decide whether they want to have a child, and not something that the government should decide. So, 2 clarifications. One, whether MOH will review this policy of restricting the number of IVF cycles after 40 and restricting IVF completely after 45. And 2, how long will such a review take?
Well, let me say that besides Singapore, some countries like Belgium and Israel also impose AR age limits due to medical and social concerns of pregnancy and childbearing at older ages. In Singapore, the current age limit, AR age limit of 45, was set or is set based on empirical evidence of that shows that the chances of conception are very low at older ages. So in fact, for AR success rates, it falls sharply at age 40, from 17.1% for women of ages between 35 to 39 to less than 7% for women from age 40 to 44. And then it falls further to about 4% for women age 45 and above. In addition, there are also increased medical risks, medical complications, as well as pregnancy, adverse pregnancy outcomes for women of older ages. So as I've said in my reply, this is really set for the patient, to protect the patient's interests, but nonetheless, MOH does consider appeals on a case-by-case basis. For the treatment cycle limit of 5 fresh cycles for women above the age of 40, again, this is due to concerns of increased clinical risks with older ages, with multiple cycles of ovarian stimulation and oocyte retrieval. But notwithstanding this, as I've said also, we recognize that there have been recent advancements made in AR technology that has actually improved the safety of AR procedures in general. So we regularly review these limits and will take into account such technological advancements as well as professional standards of care and other patient factors. It is an ongoing review, so we will make the announcements if we decide to change these limits.
Mr. Lewison.
Thank you, sir. I just want to make one point. I understand the policy intent, but what all this is driving these parents who want to have kids is they're just going to Johor to do the IVF cycles, and this places a lot of undue stress on them to travel to another country to do something that they want to do, which our government is prohibiting them to do.
So my response will be that, as I said, even as there are advancements made in AR technology, and it is safer, lower risk now to women for the AR procedure, I think we need to continue to highlight to couples who want children that notwithstanding the advancement in AR technology, the chances of conception of pregnancy at older ages has not increased, remains low, and the medical risks and adverse pregnancy outcomes also remain. I think that has to be highlighted so that they do not have false high expectations of success for such AR procedures at older ages.
Dr. Chashilu.
Just a quick clarification for SMS. I was wondering if you could share with the House for those appeals for IVF, what are some of the considerations that the Ministry takes into account when evaluating the appeals? Thank you.
So we receive about 15 patients appeal per year over the last 5 years. And some of the factors we take into account will be, of course, the medical conditions of the female patient, the maternal age, as well as, of course, the number of fresh cycles that she had previously undergone.